In this class, we are going to discuss about Lyme disease, the challenges, Lyme disease diagnostics, challenges and insights. I would like to give some introduction about Immunosciences Lab, which was established in 1989, licensed by CLIA, California, and certified by the College of American Pathologists. This is very important because when you are certified by the College of American Pathologists, also you have to perform blind testing, proficiency testing. We do that also with the College of American Pathologists twice a year. And the performance of each test is supervised by myself. I'm sure you saw in front of my name, not only PhD, MSc, but there was another one called CLS, Clinical Laboratory Scientist. I am hands-on in the laboratory and supervising every single test. And before it's released, I check every single test results, which is very important. So this is the independent survey by the College of American Pathologists. Twice a year, we get, I believe, 3 different samples. We have to report the results, and then we get our score. So as you can see in here, that sample number 1, TTD number 101, was positive for IgG, negative for IgM. Sample number 2, negative for both. Sample number 3, negative for IgG, but positive for IgM. And this is really very, very important because independently, someone is checking your performance in the laboratory. And if a laboratory fails twice in testing, probably they should stop doing that test. That's but anyway, I hope nobody will fail. So this is our certification of our participation in 2024. And before that, our overall score for our participation was 100%. That's very important. So independent surveys of lab tests are crucial because they provide an unbiased assessment of the accuracy and reliability of laboratory results, ensuring patient safety by identifying potential issues with testing procedures, the equipment that might not be detected by internal quality control measures within a single laboratory. So many laboratories doing only this part, doing internal quality control. They are not doing external quality control that we do with the College of American Pathologists. So to become familiar with principle of laboratory testing, especially for Lyme disease, and hopefully the participants in the class, by end of my talk, will be able to differentiate between good from the bad, from the ugly lab testing for Lyme disease. And unfortunately, I have to admit and saying that there are many bad and ugly testing when it comes to Lyme disease. Also, to understand the efficacy of our 2-tier testing, which is ELISA and Western blot, which is really right now the most reliable test and is the gold standard. Would like also to learn about multipeptide ELISA, which is also advanced part of the ELISA, where we measure antibodies against 14 different antigens for detection of Lyme disease, and also Western blot we are going to talk about. So these are some of the tests that currently offered by many laboratories for Lyme disease. Testing for DNA by PCR. I used to do, started 25 years ago, PCR for Lyme disease. But when I found that only 10% of the patients who had clinically confirmed had Lyme disease, only 10% turned positive by PCR. Why is that? Because we take blood for testing while the Borrelia or its DNA is in the tissue. That's the main reason. Also, that's result in false negatives. Also, if you don't have the right environment for PCR testing, the right laboratory and environment for PCR testing, you are going to get many DNA from the air into the testing sample and you get false positive. Another test is called microarray, which is a mini version of dot blot, meaning you put an antigen of Borrelia on a piece of paper in the form of dot, and then you add the serum of the patient to that. At the end, you look for yes or no test result. That's called dot plot. Microarray is taking the dot plot, which is yes or no test, try to convert that from quantitative to qualitative, which in the process yielding unreliable results. Another test called CD57, unfortunately, is done in some laboratories, or some doctors are using this for the diagnosis of Lyme disease. But CD57 is a natural killer cell, a type of natural killer cell, which I'm going to talk about more. How a type of lymphocyte could be specifically used for the diagnosis of Lyme disease. So, in my opinion, CD57 testing has nothing to do specifically with Lyme disease. And then finally, the most reliable, again, in my opinion, it's testing for IgG, IgM against different components of Borrelia, subspecies, and other associated antigens for detection of Lyme disease that we are going to discuss more. So why it is important correctly diagnosing Lyme disease? It is very simple. It is vital to correctly determine as early as possible whether someone is developing Lyme disease or something else, because false positive results could lead to years of incorrect treatment and unnecessary medications with their side effect, while false negative could result in Lyme arthritis and neuroborreliosis, which is very severe disease or diseases. So that may result also in lifetime sufferings. So it is very vital to accurately diagnose Lyme disease. Stages of Lyme disease. As you can see in the picture, there are 3 different stages after the tick bite. Primary lesion or early localized stage, in about 70% of the cases you observe erythema migrans. Secondary lesion or early disseminated stage, and you see multiple abnormalities on the skin in the form of plaque. These stage 1 and 2 may occur in the first couple months, days and months, and tertiary lesion or late stage may occur months or years later. So mainly manifests itself on the skin, but also may include late neurological and rheumatological manifestations that we call it neuroborreliosis and Lyme arthritis. So ELISA, which is really the gold standard of testing, there are more than 20,000 tests approved by FDA or equivalent in other countries who are using ELISA as a method of testing. And so therefore, I call that the gold standard. In the process of ELISA, which is enzyme-linked immunosorbent assay, we take the antigen, in this particular case, components of Borrelia in test tube like, we call that ELISA microwell, and then we add drop of blood. That drop of blood, if contains antibody in red against Borrelia antigen, will bind to that specifically. The blue antibody, which all of us, we have many non-specific antibodies, will be washed away during the washing process. And this antibody specifically could be detected by secondary antibody labeled with enzyme. So binding secondary antibody to this antibody, which is made against Borrelia antigen, bound to Borrelia antigen, detected when we add substrate to that enzyme. And in about 15 minutes to 30 minutes, the color will be developed. And again, please pay attention that the color development here is in the liquid. So it doesn't matter where you measure, in here or here, in here or in there, you get similar results. While in other methodologies that using dot plot or microarray, if you measure here, you get one result, you measure here, you get different results, you measure there, you get different results. That's why the microarray is not recommended for testing for Lyme disease. And please pay attention in here. You see that different concentration, different colors, and proportion to the color, you get almost close to 100%, 0.998, very close to 100%. If you have low levels of antibodies, you get this much color. You have higher levels of antibodies, you get more color. So ELISA is the most reliable method for testing for Lyme disease or other laboratory testing for detection of antigen or antibody. So how do we prepare the antigen to put in that micro ELISA well or test tube? Microbiology grow Borrelia in the culture. They put a medium, which is in yellow, and then they put Borrelia, and they keep it for 24 to 72 hours, and the Borrelia grows, and then they harvest that Borrelia expressing all these different antigens, OSPA, C6 peptide, OSPC, leukocyte function associated antigen, and then by breaking down the Borrelia, and we take the antigens, meaning mixture of all the antigens contains in the spirochete, put it on ELISA plate, and we measure antibody against all the antigens together. But in the case of Western blot or Lyme blot, they take, the manufacturers take that soup from Borrelia burgdorferi grown in culture and separate it based on their size. In electrophoresis, the lighter proteins move much, much faster, and the one with higher molecular weight stay at the top. So by separation, we can see each size of antigen or protein, and then doing years of clinical research and studies, they found in the case of IgG, these 10 starting from the low, 18, 23, 28, 30, 39, 41, 45, 58, 66, and 93, 5 out of those 10, if they are positive for IgG, remember, indicates ongoing Lyme disease. So IgM is not the only one showing ongoing Lyme disease. If 5 out of 10 are positive, indicates ongoing Lyme disease. This is based on CDC criteria. Now, as you can see, there are many other proteins like these, all of these here, and some in here. They are non-specific. So some laboratories reporting even these, but this has nothing to do with Lyme disease. You have to look only at proteins which are specific to Lyme disease. So again, for IgG, 5 out of 10 should be positive. For IgM, there are 3 antigens size, very important, 23, 39, and 41, but not others, okay? 2 out of these 3 are positive. Also, that indicates ongoing Lyme disease. So we do this in our laboratory. In addition, we are doing multi-peptide ELISA, which detail is right here. This is a test developed by me in, I believe, about 15 years ago. And this is the certificate of the patent. And based on more than 300 articles that I read at that time in scientific journals, I came to conclusion that for detection of Lyme disease, not only we have to test antibodies, IgG, IgM by ELISA against those antigens when Borrelia grown in culture, that many doing in the form of ELISA, IgG, and IgM. But in addition to that, we measure antibodies against separated outer surface protein A and C, and the interpretation is right here in red. I'm not going to read that. Outer surface protein E leukocyte function associated antigen, immunodominant protein C6 peptide, variable major protein E. So there are two proteins in here that when Borrelia grown in culture are not going to express these antigens. But when Borrelia gets into the human system, are going to express these variable major protein E and outer surface protein E. Therefore, it is very important to measure these antibodies against these antigens which are expressed when Borrelia is in human system. In addition to that, we are testing antibodies against 4 different subspecies: sensu stricto, Garinii, Afzelii, and Miyamotois. Again, please remember that some of these subspecies are found mainly in Europe, Japan, and some other countries. Borrelia Miyamotois found in also many countries, including in the US, but it is the agent which is called inducing hard tick-borne relapsing fever, which is very similar to Lyme disease, but it is not Lyme disease. In addition, because Babesia, Ehrlichia, and Bartonella are transferred at the same time with, in some cases, with Borrelia burgdorferi, we measure also antibodies against Babesia, Ehrlichia, Bartonella. This is our panel A. And for our panel B, we do also Western blot for IgG and IgM antibodies, which I did discuss earlier. So in my opinion, this is the most comprehensive test for detection of Lyme disease. So I would like to share with you, I believe, 4 different cases. So in this case, a female abnormal SPECT scan and diagnosis of CNS Lyme. You see how many symptoms, many symptoms, from depression, anxiety, to shortness of breath. And so therefore, the doctor did multi-peptide ELISA, IgG and IgM. As you can see, Borrelia burgdorferi, the blue is the control, our reference range, and the red is the patient's results. Borrelia burgdorferi IgG by ELISA, very high. Outer surface protein A and C, very high. C6 peptide, some laboratory to diagnosis only based on this, was positive. The subspecies sensu stricto, extremely high, and probably due to cross-reactivity or simultaneously, the patient did suffer from Babesia. So there is no doubt that this patient is suffering from Lyme disease, confirmed also by multi-peptide ELISA, in this case, IgG. The IgM also is positive, but relatively less positive, because any numbers higher than 0.9, based on the kit that we use, it's considered positive. So that's multi-peptide ELISA. Let's look at Western blot. The doctor sent Western blot to 2 different laboratories. This is immunosciences lab, and this is another lab. As you can see, that IgG, this patient had clearly 5 out of 10 antigens positive, 3, 39, 41, and then 58 and 60. For IgM, only 1 band positive. But overall, based on Western blot and multi-peptide ELISA, indeed, this patient did suffer from Lyme disease. Now, there are some laboratories reporting, as you can see, plus minus. This is not according to CDC criteria, but the lab made the decision to do that. I think in my case, either the person is pregnant or not pregnant, you cannot report negative or positive. So if we will count the positives in here, only 1, 2, 3, 4, and in here also 1 positive. And again, there is overall, I would say that there is good correlation between the 2 laboratories based on Western blot. So overall, Western blot and multi-peptide ELISA is showing indeed this patient did suffer from Lyme disease. Positive 5 bands for IgG Western blot supported the diagnosis of Lyme disease, and multipeptide ELISA also showed positive Lyme disease. So these results plus abnormal SPECT scan can confirm a diagnosis of neuroborreliosis. Case number 2 is a 57-year-old male with self-diagnosis, again, self-diagnosis of autoimmune disease. This patient developed a range of symptoms: migraine attack, blurred vision, dizziness, nausea, fatigue, fibromyalgia, and panic. These symptoms caused him to fear he had an autoimmune disease. So many tests were performed by the doctor and did also CT scan, some pathology tests, EEG. Even though the results were completely normal, he believed that he had multiple sclerosis, which is very severe disease. His fears about autoimmune MS were reinforced by these continuing symptoms: headaches, blurred vision, dizziness, being out of breath, and also being out of breath following exertion. So he thought he has multiple sclerosis. He also researched about the illness online, and there are many patients are doing that. And he had comprehensive knowledge and read many medical texts. Despite repeated reassurance by medical care providers, he was worried about that something has been missed. One day, a friend told him that because he lived in an area infested with ticks, he may have Lyme disease affecting his brain. And so he started thinking about Lyme disease. So his doctor sent blood tests to several laboratories. So this laboratory for DNA testing by PCR, and it was found positive for Borrelia burgdorferi by PCR. This convinced the patient that he had Lyme disease. I don't blame him because the laboratory did it, is behind the results. To confirm this, the patient's practitioner ordered multipeptide ELISA and Western blot through immunosciences lab. So it seems that the practitioners really was not convinced the patient had Lyme disease. So when we did the multipeptide ELISA, again, this is the highest level of reference ranges, and look at the level of antibodies of these patients against all the antigens we test. Absolutely, absolutely negative. That's for IgG. For IgM, the same thing. Absolutely, absolutely negative. So Western blot, everything is clear. 0 bands for IgG, 0 bands for IgM. So there is no doubt that this patient does not have Lyme disease. So what practitioners should do in this situation? These different tests from immunosciences lab, which were all negative, the patient still insists that he has one or more autoimmune disease induced by infection, probably by Borrelia burgdorferi. And so in this situation, really, we cannot do anything to convince the patient that he doesn't have Lyme disease because one laboratory reported false positive results. So practitioners should be wary of unproven methodology for the diagnosis of Lyme disease, as false results can be confusing for both the doctor and patient. Case report 3 is 44-year-old female who developed the following symptoms: joint and muscle ache, fatigue, headache, loss of appetite, mood change, double vision, swollen lymph nodes, lack of concentration, loss of balance, depression, stress, anxiety. Patient saw at least 5 different practitioners over 5 years, and her symptoms were dismissed as non-specific. However, the last practitioner who practices functional medicine taught about Lyme and ordered immunosciences lab test, Lyme panel by multipeptide ELISA, as well as Western blot. So as you can see, the IgG patient results in red is completely negative. But the IgM against this subspecies is highly, highly positive. All other antigens and some against Babesia, but against this subspecies is highly, highly positive. So the IgM against one protein is highly positive. Now let's look at Western blot. For IgG, as you saw in multipeptide ELISA, it was negative. Here, only 2 bands positive for IgG. But we need 5 bands to be positive in order to call this ongoing Lyme disease. But Western blot or Lyme blot for IgM, 2 bands positive. So even in multipeptide ELISA, antibodies are IgM antibodies positive against one subspecies. Western blot confirms that indeed this patient is suffering from ongoing Lyme disease. So negative for IgG and IgM for Borrelia burgdorferi, highly positive for IgM Borrelia garinii, which is primarily found in Europe and Asia, with Western blot, who showed 2 bands positive for IgM, indicating chronic Lyme that ended with neuroborreliosis. Again, this is also indication of neuroborreliosis. Case number 4, patient developed the following symptoms: red rash at the site of tick bite, facial paralysis, irregular heartbeat, low-grade fever, fatigue, sleep problems, pain, stiffness. Based on these symptomatologies, practitioner ordered the multipeptide ELISA Lyme panel with Western blot, and let's look at the results together. So the IgG antibody moderately is positive against 2 very important antigens, Borrelia burgdorferi and C6 peptide. As I said before, that some lab, they do diagnosis of Lyme disease just based on C6 peptide positivity. Here we have both Borrelia burgdorferi, all the antigens, and then C6 peptide. The IgM is positive for everything. That shows that in addition to Lyme, this patient may develop some type of autoimmunity, because when the patient reacts to all these antibodies, especially IgM, this may indicate production of polyreactive antibodies, not only reacting against Borrelia burgdorferi, could react also against variety of human tissue antigen. Western blot, okay, so IgG, 4 bands positive, but we need 5. So this is borderline. The IgM, 1 out of 2 bands positive. Even all those antibodies were reacting to every single antigen, Borrelia, Babesia, Ehrlichia, Bartonella, the subspecies. So positive for B. burgdorferi IgG and immunodominant 6 peptide. Even in the presence of 4 bands for IgG, in my opinion, confirms positivity for Lyme disease. And then positive IgM reactivity for all tested antigens by multipeptide ELISA indicates polyreactivity and possible autoimmunity. So we have to interpret that also in the context of possible Borrelia-induced polyreactivity or autoimmunity. So the last part of my talk is about CD57, which, as I said before, is a type of natural killer cell. What is natural killer cell? It's one of the soldiers of the body, knows how to protect the body against viral infected cells, stressed cells, as well as tumor cells. Doing that by releasing all these granules containing enzymes and other mediators. And when they release this bullet-like material, can kill the pathogens, including Candida albicans, other pathogens, viruses, and tissues affected or cells affected by the viruses and tumor cells. So altogether, NK cell is protecting us against foreign material. In one of my recent articles that I published less than a year ago, I discussed these 7 different types of cells, natural killer cells and cytotoxic cells. So there are, 6 of them are natural killer cells, and this is cytotoxic cells. All of them have the capacity to kill tumor target cells, viruses, and stress cells. But each one of them have different functionality, division of labor. So CD56 positive NK cell, it's weakly cytotoxic, not having too much granules, but it is involved in immunoregulation. It talks to T cell, to B cell, helper cell, Th1, Th2, and so that's its job. CD16 NK cell, strongly cytotoxic. It has more granules and knows how to kill viral infected cells and tumor cells. Now, the issue of CD57, that some laboratories doing this and wrongly or falsely connecting this to Lyme disease. But the job of this CD57 is killing tumor target cells and viruses because its function is it's strongly cytotoxic. And another job it has, deleting autoreactive lymphocytes, meaning any lymphocyte trying to attack our tissue, the CD57 destroying that autoreactive lymphocyte, meaning preventing autoimmune disease. CD57 also, its numbers are increased during aging. Guess why? Because during aging, unfortunately, we are more prone to cancer, we are more prone to autoimmune disease. So therefore, you can see CD57 really has nothing to do with Lyme disease specifically. Now, CD57 forms some kind of alliance with CD16. So it becomes the super killer. We call that highly cytotoxic, fights disease progression. So we want you to have high numbers and activities of CD57, CD16. Cytotoxic CD8 cells also, they kill tumor target cells and viruses. Now CD57 also forms alliance with CD8, becomes also super killer. So they have high killing activity. Finally, another cell involved in immunoregulation, it is a T cell with NK cell activity. So that's why we call that NKT cell, involved in immune regulation, immune protection, and controls also autoimmune disease. So I hope you are convinced that CD57 has nothing to do with Lyme disease. Why originally people thought CD57 is involved in Lyme disease? Because Dr. Stricker and Winger in probably 2000, because the article published in 2001, in few patients they found, in comparison to controls who had 200 CD57 cells per microliter of blood, they found in patients with chronic Lyme had very low, 30. After initiation of antibiotics, from 30 went up to 66, and after completion of antibiotics, went back almost to the same level of the control, 173. Okay, but since then, no research facility could repeat these findings. And so therefore, in this article, again, I talked already about this, that in this article, Marquez, who published this article in 2009, found no relationship between CD57 and Lyme disease. So in fact, his study, he looked at CD57, CD16, and CD56. And as you can see, in healthy, 110, chronic Lyme, CD57, 120. Remember, in the study of Stricker, it was right here, very low, like 20. And post-Lyme went up non-significant, but that's CD57, which is NK cell. They looked in another type of NK cell, CD16, CD56. Healthy, 200. Chronic Lyme, 220. Post-Lyme, 240. So, in fact, they found opposite finding of Stricker and Winger. So therefore, please do not use or consider not to using CD57 as evidence for ongoing Lyme disease, but you can use CD57 as a cell which is doing or killing of viral infected cells, stress cells, cancer cells, and also protecting us against autoimmune disease and cancer during aging. So I'm not saying do not use CD57, use it for those purposes. Finally, any serological test, IgG, IgM, for Lyme disease by ELISA or other methodologies may suffer from some false positivity, okay? In this article, they looked at patients who had EBV or HHV6 and then found that individual having ongoing EBV infection and HHV6 may result in false positivity for testing for Lyme disease, even by Western blot. If your patient suffering from EBV or HHV6, you may get 1 or 2 bands, which contributes to false positivity. So if you do testing, make sure and your patients turn positive by testing for IgG and IgM. Make sure your patient is not suffering simultaneously from EBV and HHV6. You may consider testing for EBV and HHV6 before putting the patient on medication for Lyme disease. That's the message of this article. So finally, it is about the method. Method is important, but believe me, every single method is good. For what purpose we are going to use that method? Like PCR is fantastic for detection of DNA, for genetic studies, for many other studies, even for cancer studies, but it's not for Lyme disease. So it is about the method and the art of the interpretation of the results. How you are going to interpret the test result is highly, highly important. Example, maybe your test results turn back positive, even by ELISA and Western blot, but make sure your patient is not suffering from EBV and HHV6. And the final slide and the summary is this, that understanding the principle of lab testing will enable you to differentiate between the good, the bad, and the ugly. And also, we should use samples that will give us reliable results. For example, if you use urine, you get different results. If you use blood, you get different results. If you use stool, you may get different results. So why you should choose a laboratory that reports reliable test results that are confirmed by external quality assessment, such as the College of American Pathologists, because based on that, and by the way, the records are available for the public and highly recommend that before using a laboratory, check their score, whether or not did external quality assessment and what was their score. So then the correct interpretation of the result is highly, highly important. I have to tell you that as part of my CLS, Clinical Laboratory Scientist, I am in our laboratory almost 8 hours a day. Every single test is done under my supervision, sometimes even myself doing the test. Before releasing the results, I check every single test. And in some cases, when the doctor's asking me, I'm writing interpretation for the results. So finally, why years of experience and research and clinical lab work matters in interpretation of the test result. So I hope you'll be willing to use Immunosciences Laboratory, and I'll be here for you in interpretation of the results. Thank you.
Welcome to Rupa Health, the best place to order, manage, and track results from over 30 different lab companies in one single place for free. It's going to take you under 2 minutes to sign up, and you can order any functional medicine lab for your client in under 30 seconds. Let me show you how it's done. So here's our beautiful interface. I'm typing in the name of my client, selecting the lab that I want to order for them, and hitting send. From there, Rupa and their amazing team handle the rest. They email the client, collect payment, and even offer an interest-free 3-month payment plan. We've also built the world's largest library of information about chronic health conditions, the lab tests that can help you find the root cause, and the evidence-based interventions that you can use to help people heal from them. It's called the Rupa Health Magazine. There, we have in-depth articles about almost any health condition you can imagine. And we give you step-by-step protocols that other clinicians have used to help their clients heal and that are verified by evidence-based sources. You should totally check it out, and it'll transform your practice. And we can't wait to see you. So make sure you sign up today at rupahealth.com.